Welcome to the Kidney Foundation of Ohio webinar series. Today we will be talking about substance use disorder and chronic illness. So before we get started, just a few housekeeping slides that I want to share. So my name is Jen. I am the Client Services and Community Manager with the Kidney Foundation of Ohio. And the Kidney Foundation of Ohio provides a broad-based direct assistance programs to patients with kidney disease. We provide educational programs for the general public, renal professionals, patients, and their families. We service 32 counties in Ohio and have an affiliate chapter in Summit County. We currently remain one of the only health and human services agency in Northeast Ohio, continuing to use providing direct dollars to patients to assist with the devastation of kidney disease. We are a Ohio-based organization, so all funds that are raised in Ohio remain in Ohio with our patients. Today's webinar will last 1 hour. You must attend the entire hour to receive credit. Your questions can be submitted through the question and answer feature on your screen. And we will try to answer those questions during today's presentation if time permits. And for future sessions, please visit our website at kfohio.org. By signing up for this webinar, you are now on our mailing list to receive any updated information on events. No one has any financial relationships with ineligible companies except for Amy Hazel, who is our nurse planner with the Ohio Nursing Association, and those relations have been mitigated. To receive credit again, you must attend the entire session, complete an evaluation, which will be sent to you after today's presentation by August 21st, and certificates will be emailed the following week. We have been approved by the Ohio Nursing Association and the Ohio Counselor Social Worker Marriage and Family Therapist Board for one contact and continuing education hour. And this webinar has no commercial support. So with all of that being said, I am going to go ahead and start the presentation on kidney disease and, substance use disorder and chronic illness. So before we begin, what I want to do is, I'm going to see if I can get this to work properly. All right, so I'm going to go ahead and launch a poll and just get an idea of what type of familiarity you have with kidney disease. So if you can just take a few minutes and check the box on the screen that best identifies your knowledge or understanding of kidney disease. So we'll give you a few minutes to do that, please. All right. Let me, we're going to go ahead and end the poll and share our results. So it looks like we've got about 13% that do know quite a bit about kidney disease, 80% that are pretty confident in their knowledge of kidney disease, and a few that have family and friends with kidney disease. So I thank you for participating in that. All right, so just a brief overview of kidney disease. So when we look at kidney disease, it is the kidneys filter waste, extra fluid out of the body. So when the kidneys are not functioning properly, toxins, extra fluid build up, leading to issues such as high blood pressure, anemia, bone weakness, poor nutritional health, and long-term cardiac and vascular disease. So I know we have a lot of people from all sorts of different disciplines. So we're going to look at chronic illness. So I do have another poll that I want to share. All right. So this is just to get an idea of how many of you do work with patients with chronic illness. So if you can take a minute just to complete this poll, I'd appreciate it. All right, I thank everyone for participating in this poll, and it looks like the majority of you are working with patients with chronic illness. And so this kind of gives me an idea of the direction for this presentation. And let's go ahead and one more poll. And this poll is just to get an idea of how many of you work with patients with substance use disorder. So again, if you can take a few minutes just to go ahead and choose your answers for this question. All right, looks like the answers are slowly coming in. All right, so it looks like we're kind of right in the middle that most people on this call today occasionally deal with clients who have substance use disorders, but it's not a main clientele that you're working with. So I do appreciate you all taking a minute just to do these polls for me. It kind of gives me a little bit of information, telling me where everybody is kind of coming from as far as their experience and work with substance use disorder and chronic illness. So just to give you a little background, I am a licensed independent social worker. I have worked in the mental health and addiction field for nearly 20 years, and then switched over to working in the renal field. So kind of have, experience in both of these areas. So today we're going to talk about substance use disorder, some issues and concerns that may come up with patients with chronic illness, especially when we look at kidney disease. And we're going to talk about some interventions that can be done to help patients that are having issues around their chronic illness and substance use disorder. So this is according to the National Institute of Drug Abuse, why people use drugs. And one of the biggest things is euphoria, to feel good. That is one of the main reasons why people will engage in substance use. And I think, for most people, people can use, for example, alcohol as, just kind of an icebreaker, an opportunity to gather with friends. Can use it responsibly, can use it socially. But when we talk about substance use disorder, it's when it becomes problematic, and we're going to look at some information on that. The next thing is to feel better. A lot of people use substance use disorder, so alcohol, marijuana, other drugs, which we'll talk about, to cope, to manage stress, deal with mental health issues. And we know that for a lot of patients who have chronic illness, whether it's kidney disease, cardiovascular disease, cancer, oftentimes there's other mental health disorders, anxiety, depression, even like adjustment disorders, where people are trying to just figure out what to do with the diagnosis they've received, or how to manage, some of the side effects of treatments that people are receiving. And so we see that people may turn to substances as a way to cope. We're also going to be talking a little bit about behavioral addictions, and I'll get more into that here as we go along. The other thing that sometimes people will use is to do better. So improve performance, such as people who may use steroids as a way of a performance enhancing drug for athletics, or even, it looked like it cut my thought off there. But just even their thinking, their performance, not necessarily as sports, but also as, in educational arenas, that they can focus better, concentrate better. An example of this may be somebody who abuses drugs for ADHD, such as Adderall or Ritalin, as a way that it helps them to focus better, and using it illicitly, not because a doctor has prescribed it. The other thing is peer pressure, curiosity. And I think when we think about, especially young people, that rite of passage, experimenting with drugs, alcohol, nicotine, whatever the case might be, that is another reason. And so when we look at the population that we are talking about, a lot of the patients that we are working with are probably using it more for the first two, that feeling good, that using it as a way of escape or coping. So when we look at substance use disorder, for those of you that work in the clinical social work or counseling field, we utilize the criteria from the DSM, the Diagnostic Statistical Manual, that tells us what are the criteria for people who have substance use disorder. And it kind of breaks it down into 3 categories. So the first category is this impaired control. So using more often than they attended. Oh, I'm going to go out and just have 1 beer, and then 3 hours later they've gone through a 12-pack. The attempts to trying to cut down or stop using, and so we see people that will be just like, I'm just going to drink once in a while, but once they start, it just kind of continues. The idea of urges and cravings, and so with people who have a substance use disorder, there is often that need to, they have that urge, they have that craving, that need, desire. And I think one of the best ideas, and we look at cravings and urges, are those that smoke cigarettes, because for somebody who's trying to quit, that's probably one of the hardest things, is they have those urges, those triggers, those cravings, and it makes it difficult to quit. The other thing, when we look at kind of more on the pharmaceutical side, or the pharmacological side is withdrawal symptoms. So patients are going through, whether it's like irritability, restlessness, physical withdrawal symptoms, nausea, vomiting when they try to stop using. And that's when we see people who have been, what we would consider to have an addiction. The next one is, we kind of look at is the social impairment. So spending more time, more money to obtain drugs or alcohol, giving up important activities, neglecting their responsibilities, whether it's within their job, their school, whatever the case might be, causing relationship problems. And so, maybe there's a tension between a husband and wife, or, a parent and a child because of the long-term substance use. Also, continuing to use despite the negative consequences, whether it's affecting them mentally, physically, emotionally. And then another area that we look at is this risky use. So putting a person in risky situations, an example would be drunk driving. But we're also going to talk about, for example, patients that are on certain medications that can be negatively affected by alcohol or other drugs. And again, possibly getting behind the wheel of a car while they're under, the influence of like an opiate. So we will, look at that. So common drugs of abuse, and there are so many out there that I just kind of put them in some categories that we're going to look at. So obviously alcohol is probably the most commonly abused drug. So, it's in today's day and age, alcohol is not the same as like a beer or a glass of wine. But even the like IPAs, which have higher alcohol content than just drinking like a regular beer. So we're seeing that, that a person is obviously getting higher concentration of alcohol in their system quicker today than in many years past. The next category is the opioids. So this includes things like heroin, but I think what's important to also recognize is that many patients that we are working with, especially those with chronic illness, may be prescribed opioids, opiate medications, such as things like Percocet, morphine, Dilaudid, to manage pain, because we know a lot of people with chronic illness do have chronic pain. And so this is something that we do see. The concern is with those medications is that risk of addiction. So in a lot of cases, and I know there have been a lot of regulations put on opioid medications, now where only certain doctors can kind of prescribe long-term, that most patients, especially if they've had like a surgery or a situation where they need to be put on a short-term opiate, that it's harder for them to try to get more of the opiate medication, which also I think creates this kind of catch-22, because for a lot of the patients with chronic illness that we're working with, for cancer, for like degenerative diseases, that chronic pain becomes a really big issue. And because there's so much scrutiny on opioid medication, that doctors are less likely to prescribe medications to patients who truly need it. And so it becomes such a problem. But I know in many situations that a lot of the patients with chronic illness that we're working with are really struggling because pain is an issue, and trying to find, alternatives that can help in that situation. And when we specifically look at kidney disease, I have an example of a patient that we are working with at in our medication program, whose social worker reached out to me, and told me that the patient has severe arthritis and to sit in a dialysis chair for 4 hours is very hard. And so we were able to put him on our medication assistance program to get access to an over-the-counter rub to help ease the pain as best as they could, to be able to manage his back pain while he had to sit in that chair, for 4 hours. So, trying to find things that we can do within our own scope, within our own power to be able to help provide comfort for some of our patients. The next one that I have on here is stimulants. And so, this is looking at cocaine, it's looking at methamphetamine, looking at even, things like caffeine, coffee. I mean, those are, considered drugs, obviously, not to that extent of necessarily consequences, but one of the things that I bring up that we see a lot of, especially younger patients, are the energy drinks, the Monster drinks, the Red Bulls, and all those things that are out there now that really have a big impact on cardiovascular. And so, having patients, especially I think of some of the younger patients that have chronic illness, that they're having to come to treatment really early in the morning. They're drinking that Monster drink. They come in for their dialysis. Their blood pressure is crazy high, and they're not sure kind of what's going on with that. And so, it is something that we try to be able to provide like education around, around that. I don't see as much stimulants being used, especially in the kidney disease, but it is something that we do see. Nicotine, which does fall under that stimulant category, again, another commonly used drug. And so we look at like cigarettes, even, to the extent of using like chewing tobacco and other types of nicotine drugs. One of the things that we see, and this is really in any chronic illness, but we know that nicotine affects the lungs, it can affect the heart, but also can be something difficult, especially for dialysis patients, kidney patients who are working towards transplant. So when we work with transplant teams, they ask that patients discontinue smoking or quit smoking or using nicotine products, even when we look at things like vapes. And so this is something where, again, I think as providers to provide education, resources to help people with that, especially if they're working towards, something like transplant. The other thing with nicotine are, we know that cigarette smoking can cause cancer. And so patients maybe who are going through cancer treatment or already have a lung disorder like COPD, and they're on oxygen and smoking, which obviously can be a deadly combination. And so this is something that we do see with a lot of patients with chronic illness. And we know that nicotine can calm the central nervous system. And so when people are dealing with stress, with anxiety, this is something that they kind of use as a crutch. And so looking at that. The next one I have on here is benzodiazepines. And this is a drug that is typically used to treat anxiety. So things like Ativan, Xanax, medications that we use to kind of help to calm people. And this is something that I know with my work in dialysis and also in other areas that we see that diazepines can be used positively in a very therapeutic way for people, but they do have the high propensity of, becoming addictive and habit forming. And so I know that a lot of patients, especially in dialysis, some of the doctors that I worked with in the past would prescribe like Ativan for a patient who's just having that anxiety, that trouble sitting in a chair. for 4 hours. But also things like these medications can help with muscle cramping, which we know is something that happens with being on dialysis. And so it's not that I'm saying these drugs should not be used, but I think it's something where we have to use them in the way that they're intended. And there are other anxiety medications that are out there that are less habit forming and can also be used. So the next one I'm going to talk about, which I think is probably one of the more controversial drugs right now, is cannabis, marijuana. With the legalization in Ohio, it's becoming more common for patients to utilize cannabis products, whether it's gummies, whether it's smoking pot, drinks, whatever the case might be. And I think it's one of those things where I'm not here to say whether or not they should be used. But I think it's something that we need to be aware of what some of the consequences may be. And we're going to talk about, that in the next few slides. The last two that I put on here are kind of, again, in that controversial category. And the first one is gabapentin. So gabapentin, which is a medication primarily used for nerve pain. It can be used for other neurological disorders, also used for even some mental health disorders. Although gabapentin isn't necessarily the common drug of choice that people are using, it is something that does have that propensity of addiction, of habit forming. Especially patients with chronic illnesses, whether it's like diabetes and neuropathy pain that they're dealing with, to just, fibromyalgia or other chronic illnesses that use that medication. Again, it's not a bad medication, but it's something that, we should be aware of, especially with patients maybe that are on other medications that can interact with this, or if they're taking, higher amounts than they should. And a lot of doctors, especially depending on the chronic illness that we're talking about, they have to sometimes dose a medication differently, and maybe a lower amount, just to be able to protect the patients, like, for example, their kidney functions they do have left. Now, I want to touch on the last one, which is the over-the-counter medications. Interestingly enough, things like Benadryl, Robitussin, these are medications that can be abused. Imodium is another one that can be abused. I do see a lot of patients in the dialysis centers that they do use Benadryl. I know there are some doctors that do not like that medication, some doctors that are okay with it. When I worked in addiction, I had a patient that I worked with. He was in his 60s, and it's kind of interesting because typically when we see some of the over-the-counter drug abuse, it's primarily younger kids. So he had a previous history of alcohol addiction. He had been sober for about 20 years. But he began abusing Robitussin and Benadryl. And one of the hard things about those medications is it's not typically a drug that can be tested on a traditional drug panel. And so, he was, I would say, going through his wife had told me, he would go and buy package of 50 count Benadryl, and within a week it's gone. Again, that kind of gives that almost like an opiate type of effect. Even Robitussin, which again, the kids, and this was very common in the 80s and 90s, they would call it robo-tripping, where they would mix that cough syrup with Sprite or something and drink it. And so these are things that, especially with patients with chronic illness, have access to and may abuse it again to get that euphoria, to get that ability to escape. And then the Imodium, which is really interesting, is it is sold over the counter, obviously, a medication used to treat diarrhea, which a lot of patients with chronic illness may have. And Imodium does have a very small amount of an opiate in it. We know that one of the side effects of opiate is constipation. And so for somebody who has like chronic diarrhea, this medication is effective in helping to stop that, just like, opiates are known to cause constipation. And again, in high amounts of that medication, it does have that effects of an opiate. And so I think it's something that as healthcare professionals, whether we're in the social work field, the nursing field, even as a community health worker, that we should be aware of, some of these things that our patients could be immune to. And so I want to share this one. It's a licensed clip art. So it does have the little shadowing in the back, but I stole it because I think it is a really good kind of view of other behavioral addictions. And so, and I say behavioral addictions in quotes because currently in the DSM-5, gambling is the only behavioral addiction that has been recognized. But I think it's important to look at some of these because things like social media, internet, gaming, gambling is another perfect example. Even things like pornography, online shopping, those are things that many of our patients that do have chronic illness that maybe have limitations in walking, in being able to get out and do things, they can do right from their phone. And so, it becomes something we look at that criteria of addiction that we just talked about, a substance use disorder. A lot of these things can play an influence in, social consequences, financial consequences, and things to that extent. For those of you who do know me, know that I do have a history of working with patients with gambling addiction and one of my passions. And it's interesting because when we look at the gambling culture, whether it's people playing online, going to casinos, even the going and buying lottery tickets, which can be, for some patients, not too difficult to do. For many patients with chronic illness, they are on like Social Security disability. They are on a fixed income, and which can be very difficult. I mean, and we're seeing this here at the Kidney Foundation of people that are reaching out for gift cards, for grocery, for gas money, because things are so expensive. And so when you look at the behavioral addiction, specifically gambling, where that enticement of, I have a couple bucks in my pocket, I stop and buy a lottery ticket, what harm is that doing? But then it builds and builds. I have an example of a story of a patient that I worked with, and she was a lottery player, and she was on dialysis, and she had brought in like some donuts or something for the dialysis staff. And then after her treatment, she, on her way home, stopped at the convenience store, picked up a scratch off lottery ticket and won like $500. And so her next treatment, she came in and she's telling us that she was going to buy us all pizza for lunch because she was so excited about her winnings. And we're like, okay, obviously there's some ethical concerns that, we can't have people buying, patients buying things every day for our staff. And it was interesting because her like cognitive distortion was that she bought us donuts, won the lottery, and there was that correlation. Because she won the lottery, that was telling her that in her mind, because she helped the dialysis center, that's what caused it. And so if she bought them pizza, then she would win more. But I think when we look at patients, especially those that can get out, that are ambulatory, going to something like the casino is an opportunity that does cater to the older population, people with disabilities, people with mobility issues. They make it easy to get people around. They will, provide a host or somebody that can help assist that patient to get to a slot machine, to get to a table game. And I'm not here to say that gambling is bad and that people shouldn't do that, but for people, especially those that are on a limited income, they're fixed income, it's hard to pay utilities and pay for gas in the car and to buy groceries and to just live, especially with the prices the way things are. And so for them, that opportunity to put a couple bucks in a slot machine with that potential of winning a lot more, again, in a person's mind, that is, if I win, I can, be able to afford the utility bill or be able to treat myself to something nice that I normally wouldn't. And I think the other thing is, and this is something that I talk a lot about, is that really gambling is the only addiction where you have the potential of your life getting better. And so that's something that we need to, really be able to listen to what our patients are saying. Again, going to the casino for some patients are that escape. It gives them that euphoria. It makes them feel good. But it's when the consequences start happening and they're chasing their losses and they're, maybe tapping into a 401k or retirement that they can't afford to tap into. And that's when consequences do happen. And so, even seeing the gaming on cell phones, on computers where there's those enticements to add money in order to get money. A lot of games now advertise that, you can win money just by playing and can, create problems with, finances because patients may, or just really anyone in general may start going into that and, it's encouraging to, pay money for perks or for different things on those games, yet you're not getting, what you're putting into it back, and can cause some financial disruptions. So when we look at substance use, chronic illness, I just want to talk a little bit about kind of the drug of choice, how it can impact the patients and the illness. So when we look at alcohol, nearly 1 billion people in the United States can be labeled as having an alcohol use disorder. Not everyone might meet criteria of full-blown addiction, but there is that abuse factor going on. One of the things that we know that a high alcohol or heavy alcohol abuse can lead to cardiovascular diseases. Moderate to heavy alcohol use can lead to more symptoms related to acute kidney injury, which long run can lead to kidney failure. And we know that alcohol impacts the liver. I mean, that's kind of primarily the organ that alcohol impacts the most. Now, with that being said, and I think it's something that to understand that, especially when we're working with patients who are older, and when we reflect back on kidney disease specifically, alcohol can be tricky. For some patients, if they've been using for 40, 50 years, they're not going to be readily saying, all right, that's it, I want to quit drinking. But we also have to recognize that some of the symptoms that they may be having can be a result of their alcohol use. The other thing is, and I've seen this, I had a patient who he was a living kidney donor for his sister who had passed away. He then went into kidney failure. He was psychologically not in a position to be able to be put on the kidney transplant list. There were a lot of mental health issues going on. He had also previously just lost his wife, 6 months before being diagnosed with kidney disease. His way of coping was alcohol. And one of the things that was really difficult was He, over the past few months had started drinking very heavily to the point where he would come in under the influence of alcohol while on dialysis, experiencing some withdrawal. So it was affecting his blood pressure. It was affecting his, even just his mood, the anxiety, the, some of the withdrawal symptoms that he was experiencing was affecting his treatment. And so it was something that, I had to work with him to get him to get into a treatment program because it was something that was really affecting his health. For some patients, and I had another gentleman, my favorite story was he was living in a nursing home, and when the cleaners came in to clean his room, they found his bottle of Crown tucked under his pillow that his family brought him. And he was so worried he was going to get kicked out of the nursing home. Granted, he wasn't necessarily what I would consider to be an alcoholic, but again, this was just something for him that it gave him that sense of like control over his life, because living in a nursing home, he didn't have much control. And so I think it's something that we have to kind of pick and choose our battles. The gentleman with the bottle of Crown under his pillow wasn't necessarily causing a lot of mental, social impact. It wasn't necessarily affecting his health. And so I think it's something we need to pick and choose. But when we talk about kidney disease, especially, and I would have patients that would like to drink their beer or wine or whatever, and I would joke with them a lot of times and be like, you know what, having a couple beers, not the worst thing in the world, but your fluid is really out of control. How about a couple shots instead? And so to really kind of give them those choices. We know that alcohol or a bottle of beer has a lot more fluid in it than having a 1.5 ounce shot. And so I think it's something that we need to kind of work with our patients, not necessarily be there to judge them or tell them they shouldn't do something. Now, as I said, marijuana is another kind of controversial topic. And, I'm not here to obviously argue about the legalization and what people can do. But I think we need to know that marijuana it can cause complications in transplant, especially with the immunosuppression medication. Most centers for transplant want you not using. Marijuana can also cause patients to decline faster. But the reality is, for a lot of patients with chronic illness, that this is a medication that does help with decreasing nausea, helping with pain. And so there is that piece of it where, even anxiety for some patients. Now, it can also have the opposite effect and can cause anxiety. And so it's something where, at least being aware to be able to provide education to patients. The cannabinoid hyperemesis syndrome, which is interesting, is it's basically a syndrome that happens after long-term use of marijuana, where patients are all of a sudden coming into the hospitals with severe nausea, vomiting, and things like that, which they're seeing more and more since kind of marijuana legalization. And so it's something that can actually have a negative long-term use, have that negative impact. And so I think it's something that we do have to, kind of recognize with some patients that long-term use can affect them. Also, marijuana can have an impact on cardiac and respiratory diseases. And so again, there are some benefits where patients do use like gummies to help with anxiety or help with nausea or even increase appetite. Marijuana causes the munchies, which again, for patients that are dealing with, chronic illness, maybe they're not eating. And so this is something that they're using to try to stay healthy. And then again, we talked about the opioids earlier. Opioids have an impact on cardiovascular strain. They also impact the immune system. And I think that's something that, especially when we look at transplant, that immunosuppression that is going on with the medications they're currently on, and then even more immunosuppression can lead to some complications. With opioids, it can lead to dehydration, which then can lead to acute kidney injury and then potentially long-term kidney failure. And again, opioids do drastically affect the liver. And so when we look at the liver, again, liver transplant, there's a lot of issues, especially with alcohol, opioids, that patients who are developing cirrhosis of the liver, they now need to have a kidney transplant, but there's the controversy of, well, they're using illegal substances. So that ethics comes into play. Should they be considered for a transplant? But then also the other piece of it is if they don't get that transplant, they're going to die. And so these are kind of some of the ethical issues coming around with this. So as I talked earlier about benzodiazepines, again, these are your Ativan, Valium. These are medications that are used as, kind of helping to decrease anxiety. We know that they can cause dizziness, they can cause confusion, some cognitive decline. And I think the biggest thing here is the slowed reaction time and severe fatigue. I've had patients that I've worked with that were to the point of abusing multiple substances, including things like benzodiazepines, pain medications, opioids, Benadryl, all of those things that have similar kind of symptoms that can be really dangerous. These medications can also cause respiratory depression. They increase the risk of heart failure, and then they can cause inflammation. And so some of these medications are known to cause inflammatory bowel disease, lung inflammation. And so again, these medications, when used as prescribed, can be very helpful for patients. But when they're abused, and again, when a patient is using this as it's intended, it's helping to calm that anxiety, it's helping to calm, kind of what they're dealing with, that way of escaping. But then that euphoria piece kicks in because now they're using more than they should, they're building a tolerance, and then it's leading to some of these consequences. So what can we do? Again, I am not here to say that patients who are struggling with chronic illness, that we should be like, nope, can't use anything anymore. I look at kind of what can we do to kind of lessen the harm. And I do take a harm reduction approach in a lot of things, especially with patients who are older that are dealing with, some severe chronic pain, chronic illness, that we have to have compassion. But we also have to try to minimize harm as much as we can. And so doing that is helping them to find maybe some alternative activities. So patients maybe that are abusing opioids or even abusing benzodiazepines to help manage anxiety, looking at things like mindfulness activities, meditation, especially when they're in a treatment, whether it's kidney related dialysis or cancer or what the case might be, learning some, breathing that can help calm a person. These are, kind of some things that I think is important to look at, and finding distractions. For some people, sometimes just having a distraction helps to turn their mind away from focusing on that chronic pain or on that anxiety, that depression. And so finding alternatives. The other thing is that there are times that we need to look at treatment for mental health for addiction. And so being able to make a referral as needed. For some people, that harm reduction approach may not be helpful and is causing more consequences. And so to be able to help patients connect with resources for mental health and addiction. And I will say it is hard for patients, renal patients that are on dialysis, or cancer patients, or patients that are having to go to some kind of consistent schedule of treatment specific to their their disease, and then they have to try to work that around a, intensive outpatient therapy program, which can be very difficult. And so in a lot of times, it's maybe making referrals to patients to individual counseling, so that they can learn to manage that addiction and mental health issues. Again, I talked earlier about that beer versus a shot, kind of give them that alternative of saying, I'm not telling you to stop drinking, but, especially with dialysis patients, let's look at the fluid. How can we, give some better alternatives? And I think what's most important is education. And so being able to provide education, and the National Institute of Drug Abuse, which is through the Substance Abuse and Mental Health Agency, which is the SAMHSA, shmhsa.gov. It has resources, education information that can be shared with patients around, some of these addictions. And I think the important thing is we need to listen to our patients, hear maybe what they're not saying. We know substance abuse can lead to long-term health problems. So if we, as people working with individuals that are dealing with not only their own health problems, but potentially mental health or substance use issue, is how can we minimize that harm? We want to help a person's to enhance their quality of life. And for a lot of patients with chronic illness, their quality of life is declining. And if there are things that we can do just to help them with that, again, that's going to be so important. We want to refer out when needed. And I think using that multidiscipline approach, that, having social workers, counselors, even like when we look at nurses and physicians of different specialties, most of our patients don't just have one chronic illness, but, they may have kidney disease and cardiovascular disease, or, they may have cancer and another disease. And so as a team, if we can work with the patient, including them on that team, to be able to help them look at what is going to be helpful for them, what can we do to help them to remove some of that harm and improve their quality of life. And I think finally, the important thing is to look at underlying reasons why a person may be abusing, drugs or other behavioral addictions. And I think in a lot of times, mental health can be a big factor. And so if a patient is just trying to manage a new diagnosis and having to go through treatment and really struggling with that adjustment, that this is something where, we can probably put into place some of those alternative activities, mindfulness, even some solution-based focus interventions that can help patients to kind of move in a positive direction. So I thank you guys. We have a few minutes. So if you have any questions, I ask that you put them in the Q&A, and I can answer those. So I'll give that a minute. The question and answer is located on your Zoom menu bar. Either did so well that no one has questions, or I put you all to sleep. So hopefully that is not the case, but so I'll let people, if you want to go ahead and type some questions. I just want to share that the Kidney Foundation has some events that are coming up. And so for those that are interested, we have September 13th will be our Harvest Walk at Mapleside Farms. Great opportunity to soak in some of the fall colors at the Mapleside Farms with this walk. And then we have our Renal Symposium, which is September 16th and 17th. This is an opportunity. We do offer social worker, dietitian, nursing, dialysis technician, transplant coordinator hours. And so 13 and a half hours are offered for that. And so I encourage you, if you are interested, again, the focus on this is primarily kidney disease, but it's open to anyone interested. And then the last three webinars of the year that we have are the complement-driven glomerulopathies. This is a webinar that will be coming up. We also have a webinar specific towards our dietitians. We will be offering dietitian hours for this one, and it is on food first, eating well for diabetes and kidney health. And then we'll end out the year with the webinar on overcoming transplant barriers. And so our webinars are free of charge. You can visit our website at www.kfohio.org to sign up for any of these webinars. And I also encourage that you, when you complete the evaluation that will be sent out after this presentation, you can we'll send out more information about these events that are coming up. And lastly, I want to, just remind everybody that we will be sending out certificates. Once we receive all of the evaluations, you will receive a certificate. For those that are social workers, we will upload the certificates into CE Broker, so that will be in there for you as well. And then I think that is it. So hopefully we'll see you at some of the upcoming events, if not at the next three webinars that will be coming up. And then we will be getting ready to get the 2027 webinars schedule out. And so we look forward to having you participate in those. And I do encourage, on our evaluation, we do ask if there are topics that are of interest. This was one of the webinars that we had people express interest in this topic. And so I encourage